Okay, so in this video we're gonna remove the CVC. Then we're gonna so we are gonna start. I had already removed on the other video the dressing. So
Come in.
hi, Miss Johnson. This is Stephanie. I'm gonna be your nurse for today. I'm gonna be removing your central line. Okay.
Okay.
How are you feeling today?
Good.
Okay. Okay. Alrighty, so we had already removed things. We're gonna throw our gauze. We're gonna start by cleaning the area. We're gonna clean our hub. I'm gonna secure it right here because it's not sutured, but it's supposed to be sutured, so we should not be worrying about it. Okay, we're gonna clean in circular motion. Okay. Okay. All right then. So here we're supposed to have sutures, and I'm supposed to have scissors to be able to remove it, but I have tweezers. With the scissors, what you would do is you grab on the nut. You grab on the nut with the tweezers, and with the scissors you're supposed to cut it and bring it out from the nut side. So you do the sutures, you remove them, and right here, well, I'm gonna remove these because we don't have sutures. Sorry. I am so sorry, I apologize. Okay. So when we're gonna remove, just make sure your patient is turning away from the side. Miss Johnson, I'm gonna ask you to please turn to your side, away, and then I'm gonna ask you to hold your breath. Go ahead and please hold your breath for me, and I'll let you know when to stop. Okay, go ahead and hold your breath. 1, 2, 3. Okay, you can let it go. You apply pressure from 10 to 15 minutes until bleeding stops. You're gonna save your catheter. You're gonna measure it and check for patency to make sure it's not broken or you're not missing any part from it. After you hold pressure for 10 to 15 minutes, you're gonna go ahead and remove and apply your occlusive dressing, pressure dressing. So there's no blood. You're gonna go ahead and apply your dressing. And I'm gonna use this Tegaderm that it's already used, but I'm gonna apply your dressing. Sure it's sealed. At this time you do date and time. I don't have a little paper, but you would date and time I'll do it here.
Those ones don't have them?
No, we didn't keep with one. So just well,
It's fine.
we improvise. So you initial and put your name, and then it should be sticking like that. Once you're done, you need to educate your patient. Miss Johnson, you need to make sure that you don't do a lot of movements with that. You don't do a lot of movements with that arm, and if you do have you have to lift something, just make sure it's less than 10 pounds, not more. And then if you know any signs and symptoms of infection, signs of swelling, redness, warmth, or itchiness, anything like that, discomfort, just make sure you call your provider right away.
Okay.
Then you will clean your area and leave the room.